Normally for South Sudanese, when a person like that dies, people come in to the family, cry together, mourn together and so forth. But this did not happen. So everybody is feeling a lot of pain, especially nobody heard that William was sick until they heard that he's dead.
Edward Massimino is in mourning after his cousin last month became a grim statistic, one of the dozens of people who died at home from COVID.
His value is one is love, respect and honesty and integrity.
William Urulay found out he had the virus on August 10th and began isolating at home in Western Sydney with friends calling him regularly.
And then every day, twice in a day, we check on him. And he also told us the Department of Health staff were checking on him. When I speak to him, the last thing we always said, you need to go to the hospital. We're ready to call for your ambulance. Or he said, no, I'm okay.
William Urulay died alone in his home from COVID last month. At just 36 years old, he'd already achieved so much and had a promising life ahead of him. He arrived in Sydney from South Sudan in 2003 through Australia's refugee program with his cousin Edward. William taught himself English, finished high school and then went to TAFE and university while working several jobs and serving on the board of multiple community organisations.
He completed his law degree and then he was accepted by the Supreme Court of New South Wales to the Law Society on the 7th of May this year. His goal was to become a lawyer so that he is able to work to support the community.
Edward spoke to his cousin on August 19th, the day before he died.
He rang me himself in the morning about 9 o'clock. He said, he is okay. I said, okay, if that's fine. How are you feeling? He said, it's better than the previous days. I didn't know that could be our last discussion. We are just blaming ourselves. What could we have done more to help him? But it was too late.
Police entered the house and found William had died overnight.
We don't know exactly in the majority of cases that unfortunately they died at home. Why they died at home? And maybe because they underestimate the degree of sickness they are suffering, and within hours their level of oxygen dropped.
In the latest outbreaks in Sydney and Melbourne, a worrying trend has emerged. 38 people with COVID have died at home, but little is known about their circumstances and why they were not treated in hospital. In New South Wales, nearly all of the 29 people were in Sydney's west. Their ages vary from people in their 20s to their 80s. Everyone who tests positive but isn't sick enough to be in hospital is cared for under the Care and Community or Hospital in Home scheme. 7:30 can reveal that of the 29 who died at home, about half were part of these systems, but the other half were not known to health authorities and were only diagnosed with COVID after they died. In Melbourne, 9 deaths have occurred at home, all in the city's northern suburbs, and 4 were diagnosed post-mortem. In both cities, the victims were largely from non-English speaking and migrant backgrounds, and their families told 7:30 some were hesitant to seek help, and their condition seemed to deteriorate rapidly.
I know firsthand, many families, they were affected by COVID. They have chosen not to get swabbed or not to inform anyone. They kept it within themselves, and unfortunately, some of them died at home.
Dr Jamal Rifi works as a GP in Western Sydney and says many COVID patients deteriorate without realising. Some decline help or refuse to go to hospital.
In the best of time, hospitals are a scary place. And in the COVID time, it's even scarier, it's lonely, and people, they don't want to go through that on their own. So that was one of the main barriers.
New South Wales Health told 7:30 there's currently enough hospital capacity for anyone who requires care, and they urged people at home with COVID to seek medical help if their condition deteriorates.
William has a good, charismatic leader who had a vision, a leader that worked tirelessly for his community and his family. a good friend, a brother. He will be missed. We'll miss him.
William's friend Christine Debu says his death has shaken Australia's close-knit South Sudanese community.
He came down for my wedding here in Canberra. So one morning I wake up and then I just got this big message saying that William is gone. We lost him to coronavirus. I didn't believe that, to be honest. Up to now, I still haven't come to the terms that William is dead.
Even more tragic for William's loved ones is the knowledge he was just weeks away from getting his first Pfizer dose.
He booked for vaccination, so I think it was due in October.
Edward is still at a loss as to why William died at home and was not in hospital.
William was living alone by himself, so he may be saying okay and so forth, but you don't know how far he was deteriorating. I came to believe that COVID, you can say I'm okay now, but down the track, 1 hour, 2 hours later, it can change.
In a statement, New South Wales Health said the number of people dying at home from COVID without realising they had the virus highlights the need for people to get tested. William's body is now being sent back to South Sudan. His mother has not seen him since he left 20 years ago.
He was telling other young people, don't waste your time, make use of this country. And that was what was driving him, is to earn a decent life after achieving all this qualification. He said hard work pays much more than doing a shortcut.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.